Good afternoon, students. Can we start the class? Okay, so we have only 1 hour, so we don't want to wait. Is there any doubt in previous class? I think most probably you would have got your LMS by today, isn't it?
No, yeah, miss.
Okay, I will upload uh, by today. The previous classes I will upload by today. Have you all registered yourself?
We didn't get the enrollment fee yet.
Oh, okay. So I think like just now they have sent it. Maybe you will be receiving by today evening. So once you registered, then I will upload all the slides and other thing. Okay. Is there any doubt with last class?
So far, no.
Yes.
So far, no. Okay. Today we will be seeing about coordination exercise. So what? Okay, in this class again, like all other technique, in this technique also you will be learning what is coordination, and for if the person is having problem with coordination, what are the exercises you will give, what is the effect and uses of the exercises, indication, contraindication, and in this particular topic you will have one more additional is special test. So you will be doing some special test, after that only you will be doing the exercises. Is that clear? Okay, so first of all, you just tell me what is coordination, what do you mean by coordination? You would have heard this particular topic many times, isn't it? Most of the time we will know the we would have heard this topic coordination from our school days. Whenever you dance, they say uh, dance in a coordination, their coordination was very good in dance. Whenever you walk, you go walk in a line, they say you have to walk in proper coordination. So you would have seen a lot of things like marching like an army. Whenever they march in a coordination. If you see, everybody will be just keeping their feet at the same time and at the same angle, everything will be same. So you would have heard about this coordination for a very long time. So you just let me in your own words you can just explain what is coordination.
The body works together efficiently.
To perform the movement. Can you repeat?
It's how the body works together to perform efficiently.
Okay. Good. Any other? Any other? Regulation and balancing of our body moving pattern. Okay. Any other thing you know? Okay.
Miss,
Yes.
the correct timing and sequencing of muscle firing combined with the intensity of muscular contraction leading to effective initiation.
Is it Google?
No, it's a reference.
Oh, okay. Okay. So actually, that is the correct definition of coordination. So actually, whenever you want to do a movement, for example, if you want to take up the water bottle from the table, so what you will do, you will be first extending your shoulder, then you will be extending your elbow, then you will extend your fingers, hold the water bottle, that means flexing the fingers and holding the water bottle, then again bend your elbow, then bend your shoulder, and you will be drinking the water. So this is called a sequence of movement. That means to do a particular function like combing hair or taking something from the table, drinking, eating, everything has a sequence of movement to be takes place. Okay, so no function will happen in just a single moment. Okay, so you need a sequence of actions, and that actions will be carried out by many joints that will be involving. Is that clear? Okay. So this sequence of movement have to be done at the appropriate timing and appropriate range. For example, when you are taking the water bottle, the shoulder first have to extend, then the elbow, then the fingers have to open up. Instead, if the fingers open up first, the elbow extend, then the shoulder is extending, means you will be either overreaching the water bottle or underreaching the water bottle. Okay, so this the second one which I explained is the incoordination. So for a coordination movement or a coordinated function, you need to have a sequence of muscle firing that is taking place in appropriate timing and appropriate range of motion. Even if the range of motion is lower or higher, then also you will not be able to do the particular function. So this is the definition, explanation of the definition. So this coordination is most of the time it is explained in terms of smoothness, accuracy and efficacy. So the movement will be performing in a very smooth manner. It will not happen like a rigid manner. Okay, it will be happening like a smooth manner, and accurate timing and muscle firing should be there, and it will be very much effective. And all these, like you can see the complete sequence. For example, if you are lying down in your bed, and you normally you keep your water bottle near your bed. Okay, so even without opening your eyes, you will just try to reach the water bottle and you will take and drink, isn't it? So nobody is there to instruct you. Everything just happens unconsciously, and in a subconscious mind everything will be happening. Is that clear? So this uh, the movement or the sequence of things that is happening in your subconscious mind or in an automatic level in a very smooth and accurate manner is called as coordination. And for this coordinated movement, you have, that means it has various levels of control, but most of the time the cerebellum is responsible for this coordinated movement. So for example, you can see like you can take people who are drinking alcohol and people who are not drinking alcohol. So whenever people are drinking alcohol, when they go beyond certain level, their cerebellum will be affected. They will not be able to coordinate any of the things normally. So they will be having incoordination. Okay, so the cerebellum is the part which is very, very essential, or like which will be responsible for this coordinated movement. Is that clear? Okay.
Yes, Miss.
So, there are some factors that is responsible or that are needed for this coordination. So, first thing is regarding the muscular control. Next is regarding your neural control. So, because there should be a proper muscle fiber firing. If it is not having proper control over the contraction and relaxation of the muscle, then also they will not have coordination. So two factors will be responsible for this particular action. One is your muscular factor, another one is your neural factor. So the muscular factor means, again here the group of muscles are responsible. One thing is, when you take up a group of muscle for one particular action, you need all these muscle group. That is, you need your agonistic, antagonistic muscle group, synergistic muscle and the fixator muscle. So all the muscle group have to do the movement in a proper sequence. Then only you will have a coordinated movement. For example, if you want to bend your elbow, so if you want to bend your elbow, your biceps have to contract, isn't it? So biceps, when it is contracting, you will be having elbow flexion. That is the main muscle. But in case if the triceps is having tightness, whether you will be able to flex your elbow, you will not be able to flex your elbow. Okay, so that means for a particular coordinated movement to be happen, you need to have a group of muscles that has to act properly. So that group of muscles are your agonistic, antagonistic, synergistic and fixators. So agonistic means the muscle, the primary muscle which is performing the movement, or which the primary muscle that produce movement by contracting. Is that clear? So that is called as that is your agonistic muscle. Antagonistic means the opposite muscle group. So when a agonistic muscle have to contract, the opposite muscle group have to relax. If it is not relaxing, if it is having tightness, then you will not be able to perform the movement. Then next muscle is called as synergistic muscle group. So synergistic muscle group are the muscle that are stabilizing certain muscle. For example, if you want to take a cup of water from the table and drink, so you need to have elbow flexion in mid-prone position, isn't it? Or in in the mid-prone position only you need to have elbow flexion. So here the synergistic will be stabilizing the other two muscles. So we know that we have three muscles for elbow flexion. One is your biceps that will be doing elbow flexion with supination. Then you have brachioradialis that will be doing with in mid prone, sorry, in pronation. Then you have brachialis which will be doing in supination. Okay, so if you want to do in a mid-prone position, some muscles need to be stabilized. So those muscles are called as synergistic. Okay, so here if you see, the biceps have to work, but for the mid-prone you need to have a brachioradialis which have to be working. If the mid-prone position is not maintained, then you will not be able to drink the water. Either it will go for pronation or supination. That means the water will spill out. So the brachialis and uh, the brachialis muscle have to, brachialis and the biceps have to be fixed, and the brachioradialis muscle have to work. Then only you will be able to drink the water. Okay, so that is your synergistic muscle which stabilizes the unwanted muscle direction. The next is called as fixators. So fixators will be either the origin of the muscle or the insertion of the muscle. So in case in biceps itself, if both the origin and the insertion is working, what will happen? Instead of taking the water from towards your mouth, you will be bending towards the table and the hand also will be lifted up. Okay, so no point in doing that kind of movement. So either the origin should be stabilized for some muscle action. So some muscle action, the insertion has to be stabilized. So this work will be done by the fixators muscle. So for a single sequence of movement, all this muscle group have to work properly. If it is not working properly, then you will not have the coordinated movement. Okay, so that is about the muscle group. So next is about the nervous control. So what will happen is, normally the input will be from the muscle. That is the muscle, for example, you want to take and drink the water from the table. So your eyes are seeing the water. Okay, so from your eyes you are seeing that the water is on the table. Okay, immediately the eyes will be giving information to the brain that the water is in the table, or the water bottle is in the table. So then the brain will give information to the muscles to know the movement of the muscle. That means movement of the joint, or you can say proprioception of the joint. So then the shoulder will give information that it is in neutral or any movement. Then the biceps, the elbow also will give information like that. All the muscles will give the information. Then every information from the muscle will be taken to the brain. The brain will plan the pattern of movement. Okay, so this planning of pattern of movement will be designed by the previous memories and the present orders or present impulses. So previous memory means, so previously whenever you have taken the water bottle, the brain will think, okay, last time when you took the water bottle, you have extended this much. You have extended the elbow to this range of motion. You have extended the fingers to this range of motion, like that. So all the previous memories will be there. Then along with that, the present impulse, the presently, what is your range of motion of the shoulder? What is the range, what is the position your elbow is? What is the position the fingers are in? Are in. So all these impulses will be taken, and they will be forming a planning. Okay, so after forming the planning, it will be sent to the cerebellum. So cerebellum is like your workstation, or cerebellum is like your control station. Okay, so the cerebellum will be receiving the information from the muscle. The cerebellum will be receiving the information from the brain. Then it will be checking the proprioception and the kinesthetic sensation. Okay, in case if needed, it will be doing a minor correction. Okay, so like minor correction, like the elbow has to be in prone position to take the water bottle. The elbow has to be in mid prone position to take the water bottle. All these minor corrections will be done by the cerebellum. Then it will be sending the efferents. Okay, so first, a particular movement if you want to do, the afferents will be getting from the afferents will be got from the muscle, and it will be taken to the cerebral cortex. Then the brain will have the previous memory and this present one, and it will be planning a pattern of movement. So this pattern of movement will be sent to the cerebellum. So now the cerebellum, after receiving that, it will be undergoing a finer tuner movement. Fine tuning, everything will be done by the cerebellum. Then it will do some alteration if needed. Then it will be sending the efferents. So after getting the efferents, immediately the muscle will act accordingly. So all this will be taking place in fraction of second. Okay, it is not like how I'm speaking. It will not take few minutes, or like it will not take few hours. Okay, so it will, everything will happen in a just a instant. Like how? So like if a mosquito is biting your hand, what will happen? Even without seeing that particular mosquito, you will automatically take your other hand and beat it, isn't it? So this is a movement. This is also a sequence of movement which will be happening like this. It will also have both the coordination, muscular control and the neural control, and it will be taking place within a fraction of second. Is that clear? Okay, so this is what happens in a normal person who has a good muscular and the nervous control. In case if any one thing is missing, then it will lead to incoordinated movement. So incoordinated movement means the timing and the smoothness will be missing in that. So they might have a rhythmic and they might have a jerky and arrhythmic movement. The movement will not be accurate. Instead of reaching the water bottle at one instant, they will either go beyond that or they will be going before it. And they will take the water bottle in after few jerky movement, they will take it. Then by the time they bring it to the mouth, they will be spilling the water here and there, and they will be bringing it. So this kind of untiming and unsequential muscle firing is called as incoordinated movement. And mainly, if there is any one of the factors affected, then you will have this incoordination. Okay, either the muscle or the nervous control is not proper, then you will have this incoordinated movement. So what are the causes for this incoordinated movement? So we have seen the muscle and the nerve. Okay, so whenever there is a problem with this two, then you will have incoordination. So when you want to go in depth and see what are the causes for this incoordination, first thing is weakness of the muscle. Okay, so if a muscle is weak or flaccid, if it want to do some range of motion and the muscle is not able to do that particular range of motion, okay, so to lift the water from the table, the elbow has to be extended from 90 degrees to 40 degrees, but the muscle is weak and it is not able to produce that much of movement, then you will have one problem. Okay, so this is the first reason is weakness of a particular muscle group. It can be weakness or it can be flaccid. Okay, so this is the problem below your anterior spinal cord. I think like in from your 1 minute. Hello, ma'am.
Hello, good afternoon, Ms.
Yes, ma'am.
Jesse.
Yes, ma'am.
நம்ம just want to ask you, நம்ம வந்து அந்த stakeholder meeting call பண்ணனோம்ல online
Okay, ma'am.
அவங்களுக்கு பேமெண்ட் நம்ம எப்படி பண்ணுவோம் மிஸ் ஜென்சி நீங்க any idea?
Actually, it is like one day அப்படின்னா 400 ringgits they have to pay. 400 ringgits.
Okay.
So usually, since they have not come here, they will not pay the extra 100 ringgit. Maybe only pay 400 they will pay.
But even though only for few hours also we need to pay 400 consider one day,
Actually, last time when we had online, they refused to pay.
Then?
Stating that like it was only 1 hour, 2 hour.
Yes, it's true. It's only 1 hour only.
So what we did is we convinced them, stating that when we are calling for the next time, we will adjust, and we didn't pay that time.
Oh, so you are calling for the online, you never pay lah?
Yes.
Okay.
But we will try to give the same people for exam paper moderation and other things. So at that time we will just manage and we will pay little extra.
But if one day means it's about 400.
400. Yes.
What form we will use? Part-time claim form or any other form?
It is like usually Miss Mohana will be doing it. We will give them the details. She will be filling the details. Honorarium சொல்லிட்டு ஒன்னு இருக்கும்னு நினைக்கிறேன் மேம்.
என்ன form?
Honorarium.
Oh, honorarium. சரி. Okay. நான் உங்களுக்கு கேட்கிறேன். Thank you.
Okay ma'am. Thank you.
Bye.
Sorry students. Okay. So in case if the muscle is having some weakness or flaccidity, this is called as LMN lesion. LMN lesion means you will learn this in detail when you are learning your neuro subject. But we will just have an overall idea about this. LMN means actually in neuro we have the neurological problem will be divided into two. One is lower motor neuron lesion, another one is upper motor neuron lesion. So lower motor neuron lesion means if there is any problem below your anterior horn cells. I hope you would have learnt in your physiology about whenever you are learning CNS in physiology, you would have learned this. So from the muscle till the anterior horn cells, it is called as lower motor neuron lesion. Okay, so if anything goes wrong below this anterior horn cells, it is called as lower motor neuron lesion. Okay, so from anterior horn cells till the brain or till the cerebral cortex, it is called as anterior horn cells. Upper motor neuron lesions. Okay, so the problem, whatever happens below the anterior horn cells, means it is lower motor The problem which happens above is called as upper motor. So when a muscle is weak, we say this is a lower motor problem because the problem is in the muscle. So when the problem is lower motor, the muscle will undergo weakness or the muscle will undergo flaccidity. So next is, in case if the muscle is tight, maybe the muscle is having some tightness, maybe the muscle is having some spasm, then we call it as upper motor neuron, and that in that case also you will not have a proper coordinated movement. Is that clear? Okay, so this is the two muscle problem. So either the muscle will be having weakness, so that is called as lower motor neuron lesion, or the muscle will have tightness or spasticity or contracture, that is called as upper motor neuron lesion. Okay, so this two will be in the muscle. The next is, if there is any problem in the cerebellum. Okay, cerebellum. If there is any problem in the cerebellum, then you will be having this incoordination. You will be having an irregular movement. You will have tremor. You will be having swaying. So, like this will happen whenever you drink more alcohol. When you drink excess alcohol, you will feel as if your head is spinning. And if you try to get up and walk, you will feel as if you are walking in moon, isn't it? So that is called as swaying. That is called as ataxia. Okay, irregular movement. Then, in case if the problem is in the sensation, so the sensation may be either the cerebellum is not receiving proper proprioception sensation or kinesthetic sensation, then we call it as loss of kinesthetic sensation. Okay, so that is called as sensory ataxia. So if a person is having any of this problem, then they will be definitely having incoordinated movement. Okay, so either the problem is in the muscle, that is the muscle may be weak or the muscle may be tight, or the problem is in the cerebellum itself, or the problem is from the sensation the cerebellum is receiving. So the sensation the cerebellum is receiving is two sensation. One is kinesthetic sensation, other one is proprioceptive sensation. So when they don't get this, then also they will have incoordination. Okay, so don't worry. We are not going to learn much about coordination and incoordination, that you will be learning in your neuro subject. We are here to learn about the technique which is given for this incoordinated person. Okay, so that's why I'm not going in depth about coordination and incoordination. Okay, so what are the conditions that are very common to have this coordination problem means, in case if any person who has brain injury. So when the brain is injured, then your cerebellum also will be affected, the cerebral cortex also will be affected. Then they will have incoordination problem. Then Parkinson's, then multiple sclerosis, cerebral palsy, cerebral tumor in the cerebellum, or vestibular pathology. So all these we are not going in depth because you will be learning in your neuro. Okay. So we know what is coordination and we know what is incoordination. So here first thing we need to understand so first thing we need to assess the person, then only we can give the treatment according to the factor affected. For example, when you assess, you find out the muscle is weak, then you need to give strengthening exercise to the muscle. Strengthen the muscle, then you have to do the, then automatically the coordination will be improved. In case if the muscle has some tightness, so you can do stretching and you can do stretching and you will be able to solve the problem. Okay, so you need to undergo assessment, then after assessing only you will know what factor is affected, and according to that only you will be able to decide what exercises you can give. Okay, so for assessing, first thing you need to check what is the skill affected, okay, or what is the level of the activity affected. Okay, how much incoordination or unsteadiness is there in the particular movement. Okay, then whether the problem is affected both the extremities or it is affecting only one extremity. Okay, so either the right upper limb is affected or left upper limb is affected or both the limbs are affected. So you need to check number of extremity involved in this particular problem. Okay, so first thing you have to check the level or the skill in activity. Okay, sometimes for example, when your grandfather is taking the water in a tumbler and drinks, definitely he is going to spill some water. Okay, this is because of aging. So naturally, because of aging itself, they will have little kind of tremor or movement and they will spill the water. Okay, so you cannot compare this with a 20-year-old boy who is spilling the water. Okay, so you cannot compare with that with 1-year-old child who is spilling the water. So this is called level. Okay, so you cannot compare 1 year, 20 years and 90 years old person. They cannot have the same level. Definitely they cannot have the same level. Okay, so this is about the skill or level. Second is like how much swaying or unsteadiness is happening in the extremity. How many extremity is getting involved. And whether the incoordination is from proximal to distal or distal to proximal. Okay, so whether the incoordination is distributed from proximal to distal or distal to proximal. Is that clear? Next is the situation that is causing the incoordination. For example, if you are very much fear, okay, so for example, if you are watching any horror movie and suddenly somebody is coming and touching you, what you will do? You will be spilling whatever is there in your hand. Okay, so it doesn't mean that you have incoordination. So you need to check what is the situation that creates the problem. Somebody, if they get nervous, somebody, if they get irritated, then they will have this incoordinated movement. Somebody, whenever they have fear, or whenever they have whenever they are extremely excited, then they will have incoordination. So you need to see the situation that is altering the coordination. Then the amount of time they are taking to perform an activity. Okay, so as I said early, so 1-year-old and 20-year-old and 90-year-old cannot be compared. They will have their own timing. So you need to see how much is the amount of time they are taking to perform the particular activity. Okay, then level of safety, whether this incoordination is affecting their safety. That one you have to check. Then whether they have any history of fall. Okay, so this one you have to check. So these are the assessment you have to check with them or ask them before going into special test. So there are some special tests. So before going into the special test, you have to check all these things. Is that clear? So now we will go into special test. So this special test is called as coordination test or non-equilibrium test. Okay, so coordination test or non-equilibrium test. So this normally will be performed actually, since coordination is mainly related to balance, so we will be checking both together. It is not that we will be checking only one, we will be checking both together. So when we are checking both together, then we will ask them to perform with eyes open and eyes closed. But if you want to perform only non-equilibrium test or only coordination test, then you don't need to do with eyes closed or eyes open. You can do with eyes open itself. Okay. So here what you have to do is, so we have some test for the upper limb, we have some test for the lower limb. So for the upper limb, first thing is the finger to nose test. So you ask the person to sit in front of you and ask the person to lift up the index finger and try to touch their own nose. And they are supposed to touch it exactly on the point. They should not under or they should not do over. Okay, so exactly they have to bring out the finger and touch their nose. So you are supposed to ask the person to either sit or stand, then extend their hand, that is uptake their hand 90 degrees, then bring the fingers to touch the nose. Okay, then you can also do by asking them to touch your finger. That is, you will be sitting in front from shoulder abducted 90 degrees. They are supposed to bring their finger and touch your finger. Okay, then they can also do it like with both the hands together abducted 90 degree. They are supposed to touch the fingertips. Is that clear? Then they can also do finger opposition. Okay, so all these tests better I will show you the video for demonstration. Okay, I'll just explain in one line, then I'll show you the videos. Alternate finger to nose to finger means, so you make the person to sit in front of you, ask the person to do shoulder abduction 90 degrees, then bring the finger and touch the nose. Then again they have to abduct, then again they can bring the finger and touch your finger. So this is like alternatively touching the nose, then touching the finger, touching the nose and touching the finger. So when they are touching it, they have to touch it precisely over the point you are telling. Is that clear? Then finger opposition means they are supposed to touch their own fingers by opposition. Okay, so mass gasp means, let me explain this with the video. So normally we used to practice this particular thing when we are let me just explain you. Okay, so finger to nose is, first you need to ask the person to do abduction 90 degree. Okay, so abduction 90 degree like this, then bring the finger and touch the nose exactly on the point. Okay, so this is finger to nose. Then you sit opposite to the patient and ask them to touch your finger. Okay, from abduction, ask them to come and touch your finger. Okay, the next finger to finger is, ask them to abduct both the fingers, then bring it together and touch the finger like this. This is finger to finger. Is that clear? So exactly over the tip of the fingers they have to touch. Then alternatively, that is either they have to touch the nose, then they have to touch the finger. Either they have to touch the nose, then they have to touch the finger. So this is finger, alternate finger to nose to finger. Okay. Then finger opposition is, you are supposed to ask them to touch like this. Sorry. Can you see here? So with the thumb, they are supposed to touch each finger tip. Is that clear? So you can just try. So with each, the thumb has to touch each finger tips. This is called as finger to finger opposition. Okay, then mass grasp is this one. So first you have to touch with closed, then one hand open, then again closed, then the other hand open, then again closed. Okay, so like this alternative. 1, 2, 3, 4. 1, 2, 3, 4. 1, 2, 3, 4. 1, 2, 3, 4. Okay, so this is called as mass grasp. Then pronation supination is on the either on the lap or on the table. They have to do alternate supination and pronation. This is called as pronation and supination. Then tapping. Tapping on the hand or tapping on the lap. Okay, next is, so all these are your upper limb test. Lower limb test is same thing. You will be doing like tapping of the feet. Okay, so you have to tap the feet. So that is for your lower limb. So you can do alternative on both the legs, or one by one you are supposed to do it. So that is called as tapping feet. Then you ask the person to lift the leg, then touch the heel of the leg to knee. This one you can ask them to do in lying, or you can also ask them to do it in standing. In case if they have good balance, then you are supposed to ask them to do it in standing. If they don't have balance, then ask them to lie down. So in supine lying, you can ask them to lift one leg heel and touch the knee. Then slide the heel over the shin. Okay, so they are supposed to touch the knee, then bring it back. Again touch the knee and bring it back. This is one test. Another one is they are supposed to touch the knee, then slide the knee over the shin of tibia. So slide the heel over the shin of tibia. So this is another one. The another one is in supine lying, they are supposed to lift their toe and touch your finger. So you can stand nearby. You can ask them to bring their toe and touch your finger. Then you can ask them to draw a circle. So whenever they incoordinated person, they will not be able to close the circle properly. They will be doing little bit over or under. They will not be able to close the circle properly. Okay, so this is one test, draw a circle test. Another one is fixation or a position hold. So here what you do is, you will ask them, you will be giving some pressure. So for example, you are giving a pressure and asking the person to, you are giving pressure and asking the person to force against your hand. Then suddenly you remove your hand. The person is supposed to hold it. They should not have do like this. Is it clear? So this is another coordination test. So that is called as fixation position. Okay. So they can also you can also ask them to do one position and hold them. That is called as fixation position. Then and this test is called as rebound test. That is, you will be giving some position and apply a force, then immediately remove the force. At that time they are supposed to hold the movement, that is control the movement. Okay, this is called as rebound test. So if they are not able to control, then they will be extending like this. So this is called as positive rebound test. Okay, so these are some of the tests. Then after doing this test, you are supposed to do on the right side and you are supposed to do on the left side. Is that clear? Then you can compare whether both are affected or only one is affected, or both are affected. You have to write about it. So for this we have some grading that is called as 5-point grade. So you can see here, grade 1 is activity impossible. Okay, so grade 1 is activity impossible. Impossible means they are not able to perform at all. Grade 2 is with severe difficulty they are able to perform. Okay, grade 2 means with severe impairment they are able to perform. Grade 3 is with moderate impairment they are able to perform. Grade 4 is with minimal impairment they are able to perform. Okay, grade 5 is they are able to perform normally. Okay, so you have a chart like this. So here you have to write either 3 or 4 or 2 like that. Is that clear? Then you can also write your comments. So this is your testing and documentation. So normally whenever you do a test, you need to document. Okay, so now we will, let me show you some videos so that you understand a little bit about the testing.
Hi, I'm David. I'm one of the medical students. Thanks for coming in today. Can I ask your name and date of birth, please?
My name's Grace Farrington. I was born on the 26th of January 1990.
Okay, Grace. I'd like to test your coordination today. It's going to involve me watching you walking and moving your arms and legs and also testing your eyes. Would that be okay?
Yeah?
Okay. So I'm going to start by asking you to walk for me. So if you start by just walking towards this wall for me. That's right. And just turn. And now if you can walk with one foot in front of the other, back to the other wall. That's great, thank you. I'm going to test your balance now, okay? So if you can just put your arms down by your side and your feet together, that's great. I'm just going to put my arms out if you feel unsteady. So if you can just close your eyes for me now. Okay, and open them up. I'm just going to ask you to repeat a few words for me to test your speech, okay? The first one is British Constitution.
British Constitution.
And baby hippopotamus.
Baby hippopotamus.
Just going to ask you to follow my finger with your eyes. Try and keep your head as still as you can, okay?
Okay, so all these tests are to test the cerebellum, okay, because cerebellum has many functions, not only this coordination. Okay, so these are to check the cerebellum.
So now if you can touch my finger with your index finger of your right hand and touch your nose and touch my finger again and keep going back and forth. Good. Good. And the same with the other finger on the other hand. And touch your nose. That's great. Now if you can put your arms out straight for me like this. Okay, and if you can close your eyes. And I'm going to push down on your arms on either side. Just try and keep your arms up for me. So I'm just going to move your arm around now. If you let me just take the weight and let it just go floppy. Have you got any pain in your arm at all?
No.
Okay, that's fine. Okay, and the same on the other side.
Okay, I think only little bit here for coordination. 1 minute.
This coordination testing, not cerebellar testing. Let me have you take your index.
1 minute.
Now I'll talk about the evaluation of coordination. There are many tests that can be done to evaluate coordination, and therefore we've chosen a few that should be used in a screening examination. It's important to realize that cerebellar testing and coordination testing are not synonymous. Patients with motor problems, with sensory problems, can have discoordination, although they do not have a lesion of the cerebellum. Therefore, this should be called coordination testing, not cerebellar testing. Let me have you take your index finger and touch my finger, asking the patient to stretch to arm's length and touch my finger in different positions. Now touch your nose, touch my finger, and go back and forth. The patient has a slight intention tremor that's visible at the end of the movement. Now I would do a similar examination on the left side. Also in the upper limb, we will test the hand coordination by having the patient perform a rapid alternating movement test, slapping his hands back and forth from back to front. Can you do it a little more slowly? And now speed up. Good. I'll have you lie down. In the leg, we'll test coordination by having the patient run his heel up his shin to his knee and back down as accurately as he can. And now the other side. Good.
Okay. Actually, I didn't get video of coordination testing alone. So it always comes with balance and other things together. Okay, normally it doesn't comes separately. So that's why the video also has some mixed thing. So I think we will stop the class here because again by 4 o'clock I have another meeting. So we will have class on Tuesday, and again Wednesday I have exam, so I will not. We will not have class. Then Thursday again we will have. Is that clear? Okay. I think by the time
Yes.
we will get the LMS, and I'll try to upload everything.
Thank you, Miss.
Okay. Thank
Thank you,
you.
Miss.
Miss.
Yeah,
Thank you, May.